the governor of the great state of the Commonwealth of Kentucky, Matt Bevin.
Thank you very much. Appreciate that. Thank you. Thank you. Well, I did not honestly realize I'd be addressing you per se. I'll keep my comments brief. Other than to say this, we know why we're here. We're here because there's not a single Republican, I'll say, who's run for federal office in the last 8 years that didn't run saying that they were going to repeal this thing. Is there? I mean, I don't think so. They may not have said that, but they certainly didn't say the opposite. There's not one person that ran saying we need more of this, we need to double down. Nobody. And this is simply a function of asking our Congress to stand up to the very promises they made to the people of Kentucky. I heard from someone, and it doesn't matter who, that they were worried about addressing this now, is that somehow this might put a tempest in the teapot during the election cycle, and this might somehow be topical and might cause people to be staying away at the polls. I was like, trust me, they will if we don't address this. Because let's be honest, who is it we're talking about? The very base that gave us a majority in the House and in the Senate and the presidency are the very people who are funding everything you've just heard made reference to. They're paying for this. And who's the they? The they is us. We're the they. The American people are, the taxpayers are. This comes at a cost that costs somebody. That's what I always tell people. Everything comes at some cost. And I stand here with Governor Bryant, with those behind me on this stage. And again, I also, in a moment, in fact, I'll do it right now, I truly am grateful to Rick. You know, Senator Santorum, this is a guy who has busted his tail on this and has continued to work this because he recognizes that promises have been made, and this is something the American people need and want. But the reason I stand here with them is not because what's being proposed is a final bill that's going to be voted on exactly as it exists. We understand that it's not. It is an outline of proposals that has tried to all the effort of all the institutes that were just mentioned by Phil, to bring into collection all the thoughts and all the ideas and all the expanded versus non-expanded needs and interests and demands and put them on a single piece of paper in a way that people can get around. Because at the end of the day, and this does matter, it is the reality of this town, I'm preaching to the choir, I know. Votes matter. Whether people vote for something or not matters. It doesn't matter if it's the right thing to do. If you don't have the votes to get it done, it's not going to matter. Sadly, that's the reality. So putting something together that Rick and his team have done and others have done for months and months and months, working on Capitol Hill, working with people, how can we come up with something that is as much of everything as it can possibly be in order to get this thing passed? That's really what he's been wrestling with, and this is why I'm standing with you, not because it's perfect, even in its outlines, not because I personally agree with every single facet of it, not because Kentucky necessarily benefits from every single thing that has been laid out if, in fact, it were to ultimately become law, but because something must be done, because the status quo is not working, period. The cost of it is more than we can bear, period. It is going to collapse under its own weight, which it already is, and as was noted both in Mississippi and in significant portions of Kentucky and in a whole lot of other states, you have a single provider, and that's not good. It's the exact opposite of everything we were led to believe. It's not creating competition. It's actually suffocating competition, and this hurts who? It hurts the consumer. And let's look at it this way. We've had this now for coming up on a decade. Healthcare statistics getting better, people getting healthier, access getting more available, costs going down, none of the above. None of the above. So something must be done, and I stand here in appreciation for the gentleman behind me and so many others that they represent in many respects. And I stand here as a state where my predecessor did expand. Phil represents a state that did not expand. We represent two sides of the equation. We're battling right now in this city, in the D.C. federal court, over whether or not Kentucky is going to be allowed to require any kind of work requirement for people on expanded Medicaid, able-bodied working-age men and women with no dependents who could go to work but choose not to, whether that's acceptable, and other people who do go to work in order to give them something they may or may not have themselves to somebody who chooses not to work. Is that acceptable? Is that American? These are the things that are being battled out right now in court. We'll see where it goes down. It'll ultimately be decided no matter what happens here at the D.C. Circuit. It'll be decided in the Supreme Court, almost without question. But the bottom line is we have this responsibility. And those that are currently elected, who've been elected, who have a passion for America, who have a heart for what is at stake, all of this is why we stand here. This has to be addressed. And now's the time. Is it perfect? No. Will it ever be perfect? No. Will there ever be any bill, anytime, anywhere that makes everybody who's affected by it happy? Of course not. Because guess what? We're all human beings. And the reality is, though, we need to do something to save the healthcare system before it truly does collapse to the point that it's not able to be resuscitated. So I'm grateful to lend my voice to it. I'm grateful to stand here, and I appreciate, again, all the work that has gone into making this happen. Thank you.